Oops. All right, now, the contraction of the heart muscle and the electrical impulses of it all kind of go together, and they can give you what's called an ECG, and sometimes they call it an EKG, and they just use K because it was German, okay, so electrocardiogram. So basically what this is, it's a measurement of the electrical impulses in the heart. So electrical impulses in the heart. So it's a graph of the changes in the channels opening up. Okay, this is what a normal sinus rhythm ECG would look like. Okay, and you're going to do this in lab. So you're going to do this in lab. You're going to take some ECGs. You're going to look at the waves and really kind of go over it. Okay, so it's labeled pretty easily. Okay, so this is, first bump is a P. The next peak is QRS. Okay, and the next wave is a T. Okay, there are flat spots, so plateaus, where no change is occurring. Okay, and there are intervals. Okay, in these flat spots, that's where contraction is going to occur. Okay, so the atria contract at the PQ segment, and the ventricles contract at the ST segment. And I'm going to show you that more here in a minute. We're going to talk about what each wave means. Okay, so here's basically what's happening, and this is graphed so you can, and color coded so you can see what's going on. Okay, so this is the P wave, and in this P wave, the atria are depolarizing. Okay, so they're getting the signal that it's time for them to contract. So they're depolarizing. So they're going up. Okay, now, when it's flat, okay, and this is going to be the PQ segment, when it's flat, like this orange part right here, okay, this is where the atria contract. Okay, so they've received the signal from there, and then they contract. And you can see on this picture they're getting smaller. Okay, so the blood is going to get pumped from the atria into the ventricles. Okay, now this next segment is QRS. Okay, so QRS, what's occurring there are the atria are repolarizing, and the ventricles, okay, they're getting the charge, they're depolarizing. So both of these events are occurring at the same time. The ventricles depolarizing, there's more cells, so typically this masks or covers up the atria repolarizing, but they're both occurring in this QRS peak. Okay, now, after that, there's going to be a flat spot. Okay, so this is called the ST segment. And in this segment, this is where the ventricles will contract. Okay, so they're going to squeeze the blood out throughout the body. Okay, and then in the T segment, this is where the ventricles repolarize. Okay, and then we'll have another flat spot. Okay, so you have to remember what you know from Bio 103 and neuron physiology. You have to remember that depolarizing comes before repolarizing. And I have a dorky way. Remember that D comes before R. So you got to depolarize before you can repolarize. Okay, so D comes before re. The atria depolarize, then they contract, then the atria repolarize, and the ventricles depolarize. Then the ventricles contract, and then the ventricles repolarize, and then we get reset to go again. Okay, now, ECGs are going to be really, really useful for figuring out abnormalities in the heart. So from it, you can determine, if you've done this for a long time, is you can determine if the SA node, the AV node, the bundles, if those are working, you can determine that. You can determine if someone's had a heart attack. You can determine if the heart is enlarged. Okay, so the peaks are going to be too high. And you can also determine electrolyte and hormone imbalances. Okay, now, it's not our job to teach you all of those. You're going to learn those when you get to your program. We just want you to know what a normal ECG looks like and what's occurring at each peak. Okay, so here's normal. So here's normal sinus rhythm. Okay, so here is one heartbeat. Okay, and then here would be the next. And then there's the next. So you can see each P, Q, R, S, T. Then you got a P, Q, R, S, T. Okay, now down here, this one below here, this is if something's wrong with the SA node. So if the SA node is damaged, so it's not working right, the SA node isn't working right, you're not going to get any P waves. So we're missing P waves. So you just have Q, R, S, and T. So the ventricles are working, they're pumping the blood, but the atria aren't. Okay, now this is a PVC, or a premature ventricular contraction. So some people, what happens is they're going along and they have P, Q, R, S, T, P, Q, R, S, T, and their heart, the ventricle gets ahead. Okay, so premature ventricular contraction, and it throws this inverted QRS. There's no P, the T is not the right shape, and they get this little blurb. They might feel it. It might feel like their heart is fluttering. Things that can cause this to happen would be stress, lack of sleep, too much caffeine, stimulants. They can cause people to throw PVCs. But I just kind of want you to see that that can occur. And it's not really a problem unless they're occurring all the time and they're affecting how efficiently the blood is being pumped. Okay, here's another abnormal one. So the AV node isn't working, so all they have is P waves. So only the atria are pumping. So this would be a problem. They're not getting enough blood pumped. This is the whole conduction system. So this is fibrillation. So this is when the heart muscle itself is trying to contract without the SA node or the AV node coordinating anything. So the heart muscle itself is trying to contract without SA or AV nodes. Okay, so the heart muscle is trying to contract by itself. So